Welcome back to my channel Dr. SP. Today we are going to talk about Zollinger Ellison syndrome, ZES, Gastrinoma. It is a non-beta islet cell gastrin secreting tumor. It may present as a primary tumor in duodenum, pancreas, abdominal lymph nodes, and it may also present in ectopic locations like heart, ovary, gallbladder, liver. What it causes? This tumor causes excess gastrin secretion that causes increased influx of acid into the stomach. So this too much acid in the stomach causes ulcers. Typically these ulcers are larger size and even recurrent after H. pylori eradication. These ulcers typically located in the distal parts of the duodenum, or it may also present in jejunum. These ulcers are multiple, not a single one. Okay, so when a patient has recurrent epigastric pain, or a patient is complaining that he has recurrent epigastric pain, even after taking peptic ulcer medication or complete H. pylori eradication, or after PPI treatment, the next initial is endoscopy. During endoscopy, we can observe the ulcers present. So we have to determine the size, whether it's multiple or single, and the location where it is located. So in Zollinger Ellison syndrome, these ulcers are larger in size, multiple, distal located in distal part of the duodenum and jejunum. So Zollinger Ellison syndrome in this patient should be considered. So the first initial diagnostic step is endoscopy. Then we need to do fasting gastrin level. It is the single best screening test. The normal level should be less than 150 picogram per milliliter. If fasting serum gastrin level is greater than 150 to 200 picogram per milliliter, that means the level is elevated. We need to do additional test, that is serum gastrin, that is gastrin provocative test. But if the level of fasting serum gastrin level is normal, we should rule out Zollinger Ellison syndrome. But if it is elevated, we need to do additional test, that is gastrin provocative test. This one is the best diagnostic test. So the increase of gastrin level of greater than 120 picogram per milliliter within 15 minutes of secreting injection, we need to diagnose this patient is having Zollinger Ellison syndrome. The gastrin provocative test is the best diagnostic test, and it also has high specificity and high sensitivity. The best diagnostic test for Zollinger Ellison syndrome is gastrin provocative test, that is persistent increase of gastrin level despite the infusion of secretin injection because normally secretin inhibits gastrinase. Other tests to remember are basal acid output test, pentagastrin test. Management: we need to treat these patients with PPI, omeprazole 60 mg per day, individual doses over 24 hours. If peptic symptoms are difficult to control with PPI, we need to give octreotide, and also we do surgical section of tumor and chemotherapy for metastasis. That's it for today. Thank you for everyone.